Mr. Chairman, I have the privilege, and I appreciate you holding this hearing today. I have the privilege of sharing the Military Construction, Veterans Affairs, and Related Agencies Appropriations Subcommittee, and that's the committee in the Congress that touches the lives of our service members throughout their entire life cycle. And it's the only committee that has that jurisdiction. One of our top priorities as chair has been strengthening mental health care for our country's veterans and their families. For fiscal year 2022, our bill made significant targeted investments to improve veterans' mental health, including a record level of $599 million specifically for suicide prevention outreach programs, like supporting the Veterans Crisis Line, enhancing community-based efforts, and implementing proven clinical strategies. With suicide rates among active military and veteran communities at crisis levels, we'll continue to be devoted to funding programs and services that can intervene and save lives. And I have a couple of questions focused on mental health, and wanted to first start with General Hammond. General Hammond, you've worked with both active duty service members and veterans throughout your career. Would you agree that the military should train soldiers to strengthen their mental health and resilience in the same way that they train for physical strength and endurance?
I would agree with that 100%. As we look at our physical health, when I came in the Army, we ran in boots, we didn't stretch, and we did all these things that can hurt yourself. And somebody had the brains to say, stop doing that, stretch before you work out, and you will last longer, your knees will last longer, et cetera. Now soldiers would never consider starting their physical training without all these stretching exercises because it works. We've done it with all these other things. There isn't a piece of equipment the military operates, whether it's our 40-year-old helicopters and tanks that work great because we have a great maintenance program. We do a pre-maintenance and post-maintenance on everything, but when it comes to mental health, when we return from deployment, we'll get asked the question, do you have any mental health issues? And if you raise your hand and say yes, you go on medical hold, which is a really disincentive for somebody who's been away from home for a year to do that. Getting out front of this and working, and I would tell you the special operations community has embraced this, and they are working this mental health strengthening thing where they work on block breathing and all these issues to work on stress reduction, anxiety reduction, which enables them to do their job much better. So preventive maintenance is really what it comes down to for good health and readiness is the key.
I couldn't agree more. And as a softball player, I can tell you when I didn't stretch before a game, I pulled a hamstring and caused me problems for months. So it only stands to reason that we should be also making sure that we're focused on the mental health of our just as much as physical strength and endurance. Can you elaborate a little bit more on what types of programs and services we could implement in military units and at DOD and the VA to strengthen the mental health of our service members and our veterans?
Yeah, yes, ma'am. I would say I'd start off with that first tool I talked about, that team at Harvard I worked with, especially on the suicide prevention, the risk assessment. You know, right up front when they first join the military, determining who's at risk. And the researchers I talked to from Harvard explained to me that 90% of our suicides come from about a 30% high-risk group that they can identify using machine learning and AI. And so we can focus those deep, deep resources for folks that need that level of care for high risk, but the universal care that they've started in the comprehensive programs that the special operators use now ensure the readiness of these warriors. And if you look at their operation tempo over the past 20 years, especially the last 10, the operators we see have 15 to 20 combat deployments, which is remarkable. And to do that, they've got to manage that stress level. And when they don't do that, we see the outcomes of the 20 a day and the 300% increase in operator suicide from 2017 to 2018.
Thank you. And talking about the much higher risk of our younger service members, I wanted to just ask Dr. Stumpf-Patton, why are our younger service members and veterans among the highest risk for suicide, would you say?
Oh, gosh. You know, let me just respectfully say that.
Doctor?
Yes, when we're speaking about suicide, when it's your loved one, it's an N of one or a population of one. You know, every case is somewhat different. Each age demographic is going to have, I think, its unique challenges and risk factors. Sometimes with younger service members, they might not have the long-term experience, the life experiences, some of the wisdom. Maybe they have not developed some of the coping skills that maybe older service members have, but, other senior service members could have other risk factors as well. In my husband's case, he was 24 years old at the time of his death, so he was a sergeant and kind of on the lower end of the spectrum, beginning his career about 6 years into it. He did have previous stressors in his life. He was a combat veteran from the Gulf War, went into a very highly stressful position as a drill instructor in the Marine Corps. We were a young military couple with a baby on the way. I thought, we were working on our dreams, had a house and a life together. Meanwhile, he was dealing with an extremely stressful job. I don't think he had the coping skills at that point. He also didn't trust the system about asking for the care that he needed. As far as being honest about some of the struggles that he was dealing with. He was coping in very maladaptive ways and turning towards things, such as alcohol, probably to self-medicate with some of those stressors of life, and being, a young person within a marriage and developing a family, and combining that with that, trying to balance a military career. But ultimately, that really speaks to suicide, again, as a very complex phenomena that has very multiple factors that can contribute to that, which ultimately can kind of vary and be very unique in a case-by-case basis.
Thank you, and I'm so sorry for your loss. And Mr. Chairman, thank you again for allowing us the opportunity to really dive deeply into this multidimensional, multifaceted problem of suicide and how we can prevent it. I yield back the balance of my time.